What about sun exposure? So I feel like there's been a fear mongering about sun in the United States that has led to less activity and outdoor activity and exposure to sun, and actually putting on carcinogens. Some of these sunscreens are actually damaging, and it hasn't led to improved outcomes in skin cancer. So there are
Well,
other experts in the United States who will say that a lot of what were the recommendations that have been made conventionally are actually leading to problems with our health.
well, if protection or measures to protect us from the sun are inhibiting people from activity, outdoors activity, that would be terrible. And the, if we have statistics that shows that would be really concerning, I would say. But the relationship between sun exposure and skin cancer, that is very easy to document. So there is a clear connection there. But on the other hand, we need vitamin D that we get from the sun to protect us from several diseases, including cancer. It has been shown that D vitamin is important for a lot of processes, and especially in like northern countries like ours, D vitamin is important. That's why we in Norway we have a tradition for giving our kids cod liver oil so that they would get enough D vitamin.
That's child abuse here.
Yeah, probably.
Dr. Breivik, I want to go back to something Roger brought up because he shared and was in your book, the calculation. It's almost like a quality of life measurement when you're determining some treatments.
The quality, yeah.
So do we need to change the way that we perceive cancer as whether or not we'll be dying with cancer or dying from cancer? Where do we draw the line there?
I'm not sure if I get your question, because we're dying more with cancer, but we're also dying more from cancer. So if you look at the disease like prostate cancer, a lot of people, a lot of men, of course, are dying with the disease and not from the disease. And there is, in general, for a lot of different types of cancer, there is a development where we're seeing that because of treatment, people are living successful treatment. People are living longer with their disease. And we're talking about cancer becoming a chronic disease in many cases. Is that where you were taking the conversation, or did I misinterpret
No,
you?
you are. And I guess it comes down to age.
Yeah.
And I think that's where we're trying to identify at what point are we 75 years old, we find out we have cancer and we think it's the end of our life. But depending on what type of cancer it is, we could live for another 10 years with that cancer, not
Sure.
be killed from the cancer. But I think there's a public perception that I need to eradicate this cancer as quickly as possible from my body and take this course of pursuing a treatment, and that treatment leads to suffering and death.
Yes. I talked to our medical community last week where we discussed prostate cancer. And we were discussing, like, how do we present this disease to the general public? Are we going to pretend that we are about to find a cure for prostate cancer for old people? Like, there is, of course, treatment for prostate cancer, and as you say, people can live with the disease for a long time. It's very hard to predict who have an aggressive type and who don't. But most people live with their disease, and many die with it and not from it. But to pretend that we are about to tell the public that we are working on finding a cure for prostate cancer so that nobody will get prostate cancer anymore, that is very misleading. So we should tell people that dying from prostate cancer is actually, at an old age, is actually quite natural.
So if we were to have an ethical discussion about where cancer research funding should go, should we dedicate all research towards childhood cancers?
Good question.
Interesting. I don't think it's like an either or, because there are, as I said earlier, there are general mechanisms. A lot of cancer research is really very fundamental molecular biology, and it is not like what. Of course, there is also a lot of specific research, but it's more like research on fundamental mechanisms, research on immunotherapy. If it works in one context, it will probably also work in another, although there are some important differences between most childhood cancers and like prostate cancers or other more age-related cancer types. So I think a more interesting question, perhaps, although I won't dismiss what you're saying, because it is a very interesting question. But if we can ask, should we spend more money on preventive medicine, on cancer prevention, as opposed to treatment, especially for older people? I would say definitely yes. But it's not as interesting from a scientific perspective. It's not very interesting from a financial perspective either. So I think it's very hard to do what we should do in terms of prevention, and a lot of prevention is not really very specifically related to cancer as a disease. It's more related to society. It's more related to, like what we already discussed, what is happening to our society that makes us that increases obesity and cancer because of lifestyle and the way we organize ourselves.
Doc, since I'm a clinical psychologist, I'm certainly intrigued by alternative approaches, mind-body medicine, some of these complementary integrative treatments that are actually even being applied with mainstream medicine. You gave them some lip service in your book, not a whole lot of time, but you referred to the placebo effect or the placebo response. And I can't help but wonder and think that if we expanded our desire to learn more about that mind-body connection, that if research money was driven more in that way, that we could potentially unlock some secrets into our own capacities to maybe heal ourselves. So what do we understand about spontaneous remission, or how people are given a placebo and their cancer goes into remission? I mean, there's documented mainstream scientific literature that supports these case reviews. So maybe you can give us an idea of what we know about this currently.
That's another difficult question, but we definitely agree, and I've listened to several of your other podcasts about the importance of the biopsychosocial perspective on disease. And I'm a huge promoter of that. I even teach it to our first-year students, and I think it needs to be modernized in the way that we have to take into account everything we now know about the connections between neurology, immunology, and the hormonal systems and everything like that. So we need to have an integrated perspective on disease. And what you're saying now is you're asking me about like spontaneous remission and how can we connect that to like mental processes, for example. Unfortunately, spontaneous remission is not that frequent. And there are a lot of, unfortunately, it's not so easy to treat cancer without the harsh treatment that cancer therapy usually is. So this idea that we can have a softer approach to cancer, that we can cure cancer with diet and with like mental approaches, I unfortunately I don't think there is much to get there. Although I think there is a lot to get on how we cope with disease, and yes, if
So I think it has. I do think it has to do with how we frame the question.
mm-hmm.
So I've only begin to start dabbling into quantum physics and quantum mechanics. Okay. And the idea that we are creators of our own reality. So I think in the typical way that we study disease and symptoms, if this idea in consciousness is that we are sick and that we are only going to be saved by a pharmaceutical, generally lends itself to very poor outcomes. I think we can agree on that. So when I talk about the mind-body connection experience, I don't know if it's something you just jump into and you change your diet and you change your mindset and that cures cancer. Because we have to also think about what is cancer doing, especially if you get it at a young age. What is its mechanism? Is there an underlying disease state in which the cancer cells are reacting to? Is there emotional component to this, to cancer? Life is really, really hard. And there's a lot of people who live life who aren't necessarily suicidal, but understand that life is very difficult and really are kind of neutral whether they are to live or die. Is there something even ingrained in us that there's this, when there's a desire and intention to really live and a strong belief that we can heal, that then we unlock other opportunities to strengthen the immune response? What about meditation? What about a lifestyle that lends itself to restoring the body to homeostasis that can at least open up future research? We don't dump money into that. We dump money into the allopathic model.
Well, I think that both diet and mental health is very important. But I think it is very dangerous to go in the direction of saying that children are getting cancer because they have psychological instability or something like
no,
that.
yeah, I don't think we're certainly not. That's certainly not the question at all, because we understand it goes back to you mentioning biopsychosocial. So we certainly understand that. That's why I asked the question. Well, why would children get cancer? It just seems like it doesn't fit this model that you're going to get cancer as you get older. Something else is happening there. So we're not saying that it's causal, right? We're not saying it's causal. What we're saying is, what are our alternative options to strengthen the human body to even when we are exposed to toxins and carcinogens? Some people get sick, other people don't get sick. And you mentioned epigenetics as the potential reason for that. But it's about where are we going to devote research as a global community, as a culture. If you're saying that there's really no cure for cancer, but we're still going to continue to dump money into the same kind of novel medical approaches, and we're not going to see great results, then why aren't we considering all options in how to live well?
Well, I think at one level, totally agree with you that we should focus more on life quality and less on life extension. And I think it's as simple as that. And then we have to find out what is life quality, and that's kind of we can generally agree on some aspects, but it also is very different for each single person. How do they want to live their lives?
Yeah.
For some, like eating a great meal, drinking a glass of wine, enjoying oneself, smoking, having a cigar, if that's the meaning of life, I'm not going to take that away from people, although I would know from the statistics that they are probably shortening their lives. So I think we have to have the discussion about what is quality of life, and then we have to relate that to that this life will end.